NBA's return bubble includes giving players the option to wear this smart ring that is said to predict COVID-19 symptoms up to 3 days in advance. The WNBA and MLS also set to come back in Florida. Hockey is working on playing in hub cities. I spoke with Bulls head physician Dr. Brian Cole, who's also managing partner at Midwest Orthopedics at Rush, about how safe it really is for these sports to return.
If you asked me, where I was comfortable, where I was not comfortable, if I was able to live in an environment where me and those around me could be tested on a regular basis, and that if there was someone who was tested positive or became symptomatic and they could undergo sort of contact isolation, I would feel safer there than I do given the randomness in the grocery store and the places where people are not abiding by social distancing, masks, or proper hygiene. So what I've read across the board, I think is very, very responsible.
Of course, even with the best laid plans, there are still a lot of unknowns when it comes to COVID-19 and trying to bring back sports after a long layoff.
Every week we find out something different, and this is going to be somewhat other than what we saw in European soccer, which the main problem was just startup injuries or 7 or 8 injuries in a very short amount of time. Other than that issue, we don't really have a lot to learn from, and we always feel better when we're learning from something that's historical or that we can borrow from our knowledge in the past. We don't have a whole database to base this on. We're basing it upon science, and I think we can do better with this than predicting what the market's going to do, quite frankly. I feel more comfortable with this than I do betting on the market. How's that?
And Dr. Cole didn't want to speculate about when we may safely have fans at sporting events, saying it's baby steps at this point.